Do you have one hospital system or a region of the country where you did a turnaround and you really use that as a benchmark for your success?
One that frequently comes to mind is Wishart Health Services, which is the safety net provider in Indianapolis.
Mm-hmm.
It's a large, complex tertiary facility. It's the largest research and teaching facility for the Indiana University School of Medicine system. Mm-hmm. And by charter, Wishart must be managed by the Indiana University School of Medicine, and particularly a physician from that faculty. Mm-hmm. And we were fortunate to go into that situation a few years back, and at that time, the parent company, Marion County Health and Hospitals Corporation, which is led by Matt Gutwein, he made a decision and was supported by the board in beginning with a new CEO, as the prior CEO had retired, Lisa Harris, who's a physician practicing in the IU faculty, mm-hmm. To bring her in as CEO, but recognizing the organization had a decade of losses, that Lisa would probably need some help. Mm-hmm. So we developed a relationship where we wrapped around turnaround support services mm-hmm. Around that relationship, and to support Lisa as CEO. And in fact, I spoke with Matt just a few months back, and he told me that the organization had increased its cash from about $10 million when we arrived to about, I'll just say, north of $250 million.
Wow.
And the point being, that was a sustained turnaround. Mm-hmm. Everything we worked so hard on to actually improve process, to train staff, to make sure that they understood how to do their job and to manage at every level in the organization, mm-hmm. it is very gratifying. And that's what Matt and Lisa point to when I have conversations with them today, is the magnitude of the turnaround, the fact that quality was improved, that volumes improved, 10% increase in surgeries after 24 months, all because of improved throughput. ER volume being up because of improved clinical throughput in the ER, and getting off what's called diversion, where ambulances with critical patients are sent someplace else because that ER is too crowded. Mm-hmm. So we were able to fix many things in the clinical realm in terms of throughput, in the revenue cycle realm in terms of billing and collections and coding, and in the operational realm in terms of staffing and supply chain efficiencies and many related areas. And again, making sure that everyone in the organization, really for the first time in a long time, 10 years if you accept that rolling loss as a benchmark mm-hmm. Of performance, actually felt really strong about what they were doing as managers and employees.